Have you ever pondered why understanding ECG readings is crucial in cardiology? Well, let's delve into it. ECG, or electrocardiogram, readings are the cardiologist's roadmap to the heart, providing vital information about the patient's heart rhythm, size, and position. It's like a stethoscope for a cardiologist, but instead of just listening to the heart, they can see its electrical activity. When a patient walks into a clinic with chest pain or discomfort, the first thing a medical professional will likely do is take an ECG. It's an immediate, non-invasive method to identify possible heart conditions like arrhythmias, myocardial infarction, or heart failure. Moreover, ECGs can predict future heart problems, helping doctors to proactively manage a patient's heart health. It's not just about diagnosing the present, but also about foreseeing the future. Therefore, accurate ECG reading skills are paramount for any medical professional, especially cardiologists, as they directly impact patient care and outcomes. In other words, ECG readings serve as a cardiologist's primary tool in identifying and treating heart conditions. The process of reading an ECG begins with understanding the basic components. Let's break this down. First, we have the P wave, which represents the electrical impulse that causes your heart's atria to contract. This is the initial phase of your heartbeat, where blood is pushed from the atria down to the ventricles. Next, we come to the QRS complex. This set of 3 waves represents the contraction of the ventricles, which allows blood to be pumped out of the heart and into the body. This is where the real heavy lifting occurs in the heartbeat process. Following the QRS complex, we have the T wave. This wave represents the period of electrical recovery or repolarization of the ventricles. It's the heart's way of resetting itself for the next contraction. Now, it's important to understand that an ECG is not just a single view of the heart's electrical activity. It's more like a multi-angle video, with different leads providing different perspectives. The 12 leads of an ECG are like 12 different viewpoints, each offering unique information about the heart's electrical activity. Think of it like this. If you were to watch a play from one seat in the theater, your view would be limited. You might miss some action happening stage left or stage right. But if you could watch the same play from 12 different seats simultaneously, you'd have a much better understanding of the whole performance. That's what the 12 leads of an ECG offer, a comprehensive view of the heart's electrical performance. So to recap, the basic components of an ECG are the P wave, representing atrial contraction, the QRS complex, representing ventricular contraction, and the T wave, representing ventricular recovery. And remember, an ECG isn't a single view of the heart's activity, but 12 different views, thanks to the 12 leads. With these basics in mind, we can now delve into the specifics of interpreting ECG readings. Now that we've established the basics, we can walk through the step-by-step process of reading an ECG. First, determine the heart rate. If the rhythm is regular, calculate the rate by counting the number of large squares between 2 R waves. Then divide 3000 by that number. If the rhythm is irregular, count the number of RR intervals in a 6-second strip and multiply by 10. Next, analyze the rhythm. Look at the RR intervals. Are they regular or irregular? Is there a P wave before each QRS complex, and is the P wave regular? This will allow you to distinguish between normal sinus rhythm and arrhythmias. Now let's examine the P waves. The P wave represents atrial depolarization. Notice the shape, size, and direction of the P wave in each lead. Is it upright or inverted? Is it abnormally large or small? Next, assess the PR interval. Measured from the start of the P wave to the start of the QRS complex, it should be between 3 and 5 small squares. A longer PR interval may indicate a heart block. Then inspect the QRS complex. This represents ventricular depolarization. It should be less than 3 small squares wide. A wider QRS complex can indicate a bundle branch block or ventricular rhythm. Finally, evaluate the ST segment and T wave. The ST segment should be isoelectric, meaning it's on the same line as the baseline. Elevation or depression can indicate myocardial injury. The T wave represents ventricular repolarization. It should be upright in most leads. Inverted T waves can indicate ischemia or infarction. Remember, these steps are not isolated. They interrelate to form a complete picture of cardiac electrical activity. By methodically working through these steps, you build a comprehensive understanding of the ECG. This systematic approach enables accurate interpretation of ECG readings, leading to effective diagnosis and treatment. To wrap up our discussion, let's highlight the key points about ECG reading. An ECG is an essential tool in cardiology, providing a real-time visual representation of the heart's electrical activity. This reading is composed of various waves and intervals, each reflecting a specific part of the cardiac cycle. When reading an ECG, the process is systematic. Start by identifying the rate and rhythm, then examine the P waves, PR interval, QRS complex, ST segment, T wave, and finally, the QT interval. Each component gives us valuable insights into the heart's function. However, it's not enough to just recognize these patterns. A good understanding of what these patterns mean for the heart's function and the patient's overall health is pivotal. From recognizing signs of hypertrophy and chamber enlargement to identifying ischemia or infarction, your accurate reading skills can make a significant difference in patient care. Remember, mastering ECG reading is not just about recognizing patterns, it's about understanding what those patterns mean for the heart's function and the patient's overall health.